Fantastic. Welcome, everyone. I'll just give it a split second while I see that folks are still joining us. But in the interim, I hope everybody is doing well. We do have now a nice fancy background with our Rush logo, which we're super excited about. But welcome to our monthly conversations on brain health. For anyone who is joining us for the first time, this is a monthly webinar series that we always run on the second Monday of every month from 6 to 7 p.m. Central Time. And we like to cover various research topics related to brain health. And this evening, we have a really remarkable lineup of speakers that are joining us that we're absolutely thrilled to have with us. And this is in honor of MS Awareness Month. But we also have a surprise guest who is joining us, which was not on the original communication due to the fact that this is also NMOSD Awareness Month, which is neuromyelitis optica spectrum disorder. Oftentimes, historically, has been confused with MS. So a dear friend and colleague of ours, Sumaira, will be joining us as well. So for our lineup this evening, again, I'm super thrilled to have Dr. Lisa Doggett joining us, Dr. Susan Payrovi. We'll have Alexis Klein joining us, and Sumaira Ahmed. So a little bit about each one of our speakers for this evening, and this is going to be a very casual set up, no presentations. This is all going to be more of a just live discussion with these amazing women. So a little bit about Dr. Lisa Doggett. She is a family and lifestyle medicine physician at UT Health Multiple Sclerosis and Neuroimmunology Center in Austin, Texas. Wonderful group. We've worked with them in the past, and so lucky to have her join us this evening. She is the author of an award-winning memoir called Up the Down Escalator: Medicine, Motherhood, and Multiple Sclerosis. So Dr. Doggett will be bringing a unique perspective on living with multiple sclerosis, combining her medical expertise with her personal journey. And how she managed to do this is pretty remarkable. Mom, doctor, and writing a book. So kudos, super impressive. And then we have, which is showing up on your screen as EE. We couldn't actually switch that over, but that is Dr. Susan Payrovi. She is an anesthesiologist and palliative medicine physician at Stanford Medicine Healthcare in California. She is also the co-founder and chief scientific advisor of True Medicine, which is an online lifestyle program designed to support individuals with multiple sclerosis. Her work is focused on integrating lifestyle changes to help manage MS symptoms and improve quality of life for patients. So another amazing individual. And then we have Alexis Klein, who we wanted to bring in from MSAA, so Multiple Sclerosis Association of America. Wonderful organization, so we're super pleased to have her join us. She will provide us with some valuable insight into the programs and resources available for patients with MS through MSAA. And last but not least, a very dear friend and colleague, Sumaira, who is the founder of the Sumaira Foundation. The Sumaira Foundation is a global organization, and they have done a tremendous amount of advocacy work for patients with NMOSD and MOGAD, and just truly, sincerely has blown me away with the work that they have managed to accomplish through that foundation. So on that note, I am going to turn it over to Dr. Augusto Miravalle, which all of you hopefully know by now, but Dr. Augusto Miravalle is our division chief at Rush University Medical Center for the MS and Neuroimmunology Clinic. So Dr. Miravalle, I'm turning it over to you.
Kathy, and what an amazing panel. And, in addition to being MS and NMOSD Awareness Month, this is also International Women's Month. And what a wonderful way to celebrate that with this amazing panelist of successful leaders and very inspirational leaders in everything you do and everything you represent. And I will be remiss if I didn't mention that today also we are celebrating another amazing leader. We celebrate the death of Harriet Tubman, which we all know as that leader that actually fought with her life for freedom. And what an amazing opportunity to perhaps reflect on the price of freedom so we don't take it for granted. So with that, maybe start thinking about and talking about how we got here. And all four of you have a different path, but somehow came to a very similar place, which is incorporating MS, NMOSD as part of your life. You've been diagnosed with that, but also you have scientific background that allowed you to perhaps look at that through a different lens. So maybe start with Lisa. If you can probably give us a summary of how you got where you are now.
Sure. Thank you. I'm so honored to be here. It's really exciting. My journey has been a very long one. I was diagnosed with MS over 15 years ago. And at the time of my diagnosis, I was directing a clinic for people without insurance. And I was raising two little girls. My daughters were 2 and 4 at the time of my diagnosis. I actually wrote this memoir because it was a way of kind of processing this experience, which was really, really overwhelming. And I think a lot of people have that experience of just total shock with a diagnosis like MS, because it does tend to come when you're, there's usually no risk factors, or, there's not a lot of preceding warning. And it also comes often in people's lives at a time when they're young and maybe building their career or starting out. And it can be very devastating. Certainly for me, it was really, really difficult. I had dizziness. That was my main symptom. I had it every day for a few years. Took me a long time to learn how to deal with it, how to reduce it, how to deal with some of my other MS symptoms too. But I managed still to kind of persevere with a lot of support. I had a great medical team, really good family support, good friends, and that was absolutely key to helping me thrive with MS. I also really embraced lifestyle medicine. I think we're going to talk a little bit more about that, but just making sure I was doing everything I could to minimize my stress and take good care of, a good diet, good nutrition, good exercise every day, to just stay as healthy as I possibly could. And ultimately, I've been able to live a pretty normal life thanks to lots of good help and making those priorities for lifestyle along the way.
Excellent. Thank you, Lisa, and resonates with me and many of the things that you mentioned. But I wonder how much of that, having that background in medicine, helped, or perhaps it was a factor that made you worry about certain things that if you didn't know about that, you didn't worry. So when you reflect back into having that background in medicine, was that helpful or not?
It was really a double-edged sword. I think, on the one hand, I knew how to get information, but starting out trying, and that was my inclination right after my diagnosis, was like, let me go and figure out, all that I can learn about MS. It was interesting also. I didn't think that it didn't occur to me that I could have MS. I had these kind of vague symptoms, like a lot of people with MS, like dizziness, some visual changes, some tingling and numbness, but nothing that was really definitive. And I think that that even before my diagnosis, I was like, what do I have? I maybe have a brain tumor, really kind of freaking out about that. It didn't occur to me that I could have MS. So once I got that diagnosis, I had to go and start researching it. I think this is part of the problem with why we often see people getting a delayed or a missed diagnosis, because it is tricky. But then I started researching it, which is my inclination when I don't know something. And that was really hard because I started reading about all of the worst case scenarios. and start panicking, that's going to be me. And I didn't realize that there were good treatments. Even back 15 years ago, there were decent treatments. Now there are much better ones, and I'm grateful for that. But I had a lot of learning to do, and it was tricky as a health professional. Even some advantages, but not all positive things.
Oh, wonderful. Well, I'm going to jump in with a question or two for you as well, Dr. Doggett. Um, how has living with MS shaped your approach to patient care and advocacy for those living with chronic illnesses?
Well, it's a great question. I was always a big patient advocate. I took care of people who didn't have insurance or had, really limited access to care. Certainly no one with private insurance at my clinic, and they needed a lot. They didn't have a lot of resources, or a lot of them didn't have really the skills to be good self advocates. So I really made that a priority that I could, just be there to help my patients persevere. But having MS really made me even more resolved and committed to supporting others. It also reinforced the importance of having a strong support circle for me. I think I knew that kind of intuitively, but I didn't. I kind of thought, before MS, I'm independent. I don't need help. And then when I got diagnosed with MS and was raising these two kids, my husband is a wonderful father, but he works in a hospital as a pediatrician, and he wasn't home a lot of evenings and weekends. So I was often by myself, and I really, really struggled, and had to start getting help. I had to realize I cannot independently deal with all the stress of having MS and raising these kids. And so I learned that having that support circle was key for me and for my patients, and started really making sure that my patients, especially now, that they do have sufficient support. So advocating for them to identify, build support circles, build this important social relationships, really, really a great lesson for me.
Yeah, go ahead.
No, what I was gonna say, Lisa, how powerful is to hear you say, ask for help when you need it, because I think it's
Yes.
human nature not to, and I think we all go through the very same process when we are faced with an adversity like that, saying, "Well, I'm gonna take care of that. I'm gonna try to preserve my environment from what I'm going through, and I'm gonna bottle that up, right?" And there is so much to be said about sharing that when you're ready, and knowing when to ask for help. So I'm going to take us to Susan now. Susan, maybe I can ask you a very similar question. If you can tell us, perhaps your journey, or how did you get here?
Sure. So I was 4 years out of residency practicing anesthesia at a trauma center in Los Angeles. I loved it. Like, I love adrenaline and not sleeping and taking care of patients. And I was doing that at like 100 hours a week. And that's just, that was my personality always. And after having my first child, within a month, I realized I had a weak left arm, and I couldn't intubate or do life-saving procedures in the operating room anymore. And it just dawned on me that something's very wrong. Four neurologists missed the diagnosis, and I was told, "You're a new mom, you're just stressed, you're not sleeping." I had a lot of wrist tendonitis, so the arm, was weak, but we just kind of chalked it up to that. But I think this is where being a physician helped, where I just remembered my neurology professor in med school saying weakness is not a good neurologic sign. And I remember that. I go, I'm actually weak. And it wasn't until my mentor, a plastic surgeon, said, "Hey, I think you have MS." I mean, he just said it very just casually. And the moment he said it, it was like, oh, this makes sense. So even as a physician, I was too close to it to see it. But the moment he spoke those words, I was like, it was like the warm rush of water just kind of going down your body. Went to my primary doctor, ordered an MRI, and there it was. So it took me about 9 months to get diagnosed. And in what I realized was that here is my neurologist wants me to do certain things, which I'm going to do. But what else can I do to improve my health? Because I had a baby and I just didn't want to lose function, or I wanted to maintain as much function as I could keep. So I ended up going to an integrative medicine conference. I knew nothing about it because I'd also pretty much just ended my career as an anesthesiologist. I had a weak left arm, so I just couldn't practice safely anymore. So I went to this conference because I was trying to figure out what to do with my life. But then I realized, oh, I've never learned this information. And what if it does help to do all of this in addition to what I'm going to do with my neurologist? So one thing led to another, and I studied mind-body medicine and Chinese medicine and acupuncture and functional medicine. And I just really fell in love with this body of information of using non-pharmaceutical therapies to just boost everything else that we're doing in conventional medicine with medications and surgery. There's always a place for lifestyle. And as I had this really powerful improvement in my symptoms, as I kind of cleaned up my act and I started taking care of myself better and just stopped like beating myself up for, like making myself work 100 hours a week, I had a lot more work-life balance. And things improved like over the course of 6, 7 years. I got a lot of function back. And I think what I want to say about MS is that, for example, my symptoms weren't severe. I could still function in my day to day, but even my pretty mild symptoms had a huge impact on my personal life. Like it ended my career for something I had studied for 4 years, and I had to go spend tons of time retraining. So this is the impact of MS. Even if it feels like it's minor, it has a ripple effect. And like Dr. Doggett said, it's often people in the prime of their lives who are getting diagnosed with MS. And, it's when you're trying to start a family and you're like starting out in your career. So there was a period of time where I had to kind of figure out how to put my life back together. And I now practice at Stanford and I do integrative and functional medicine. And what's really cool about that is that while I get to help a lot of other people bring in these therapies that are really health promoting, I get to work on my own health every day because I'm talking about it all the time. So it has a lot of side benefits for me.
Yes,
Susan,
beautiful.
thank you. I mean, there is so many things you said that we can totally unpack into because it's so important. But the one area that resonates with me is this concept of, in traditional medicine, we always operate or tend to operate in silos. And as much as we all endorse and want to follow evidence-based medicine, there is a lot of areas in medicine that perhaps we don't have the evidence yet, or the evidence is starting to become a little bit more available, but they could have a profound effect in someone's quality of life. And I'm glad to see that lifestyle medicine is becoming more accepted and more evidence-based. And I think now we are ready to actually endorse that, fully endorse that. But that's changed in the last, I will say, 2, 3 decades, in which we are now starting to recognize the importance of that. But it's also interesting to see your dual perspective as a physician and as a patient on the journey that you went through and how much we can learn, even for the way we practice medicine by listening to our patients' stories and all the things they went through, whether it's, misdiagnosis or gaslighting or, due to lack of, awareness of other areas of medicine. Sometimes physicians even dismiss patients' interest. So thank you for sharing that. And so we don't lose momentum on stories, and then we'll get back to some more in-depth discussions. I would love to put Sumaira on the spot now and, maybe ask you the same question, Sumaira. How was your journey and how did you end up creating the #1 global organization for NMOSD?
Oh my gosh, well, that's far too kind. And I'm also really, really happy to be here. Thank you for having me. It's really nice to um, hear from, heroic women or sheroic, however we want to say it. But, and Alexis, nice to see you. It's good to be amongst friends. I want to answer the question with a story, if that's okay.
Yeah.
So last week, I live in Boston, and I received an email from a neuroimmunologist at Brigham and Women's Hospital here in Boston. And she emailed me and she said, Sumaira, I hope you're well. I hope you remember me. I have a newly diagnosed patient admitted in the hospital with NMOSD. She's really young. She's very scared. Her parents are nervous. She's going to be okay. But like, does your foundation still reach out to patients who are kind of like in crisis? And she's like, it would be great if someone from the foundation could email her. And so I wrote back right away, and remembering, myself in that situation almost 11 years ago, wishing that I had that kind of support. And so I wrote back and I was like, well, first of all, of course I remember you. It's Dr. Tamara Kaplan at Brigham. She's wonderful. And second, I actually happened to be in Boston this week. I'm usually traveling all the time, and I would be so happy to visit the patient if she was open to it. And the doctor wrote back like enthusiastically immediately. She couldn't believe I still responded to my own emails, because I'm never going to relinquish my emails. I'm just going to set the record straight here. But she was like, that would be amazing. I think it would be so helpful to the family. Like, are you sure? I was like, of course. So I moved some things around in my schedule and went around like noon to go see this patient. And I brought like a TSF care package, which includes our unicorn plush toy, bracelets, a handwritten card, like stickers, a pen, just, happy things to make her feel good. And so at first I greeted the doctor, who I haven't seen in 5 years. And just a backstory, I used to work at this hospital for 6 years before I went full time with the foundation. So it was just like a homecoming feeling. And so it was so great to see the doctor. She was kind of nervous. And I mean, I guess I was too. But anyway, we go to the patient's room, and as soon as I walked in, the parents started crying. And it was such I don't even know, I'm still kind of processing it. I don't know how to describe it, because usually when I see people, I make them smile or I make them laugh or something like that. I've never had a reaction where people see me and they cry. And I don't think that they cried because they were sad. I think they cried because they were relieved. They saw a person, a young woman, also brown, who has the same disease that their 19-year-old daughter was just diagnosed with. And so it was a very emotional response from everyone, actually. And I, sat by the girl's bedside. We talked for about 40 minutes. I told her all about like my journey, but also like how far we've come with understanding NMOSD, caring for NMOSD, the fact that there are 4 FDA approved therapies. Like, I wanted her to know that like getting diagnosed in 2025 was actually like a much better situation than even 5 years ago. So like kind of to provide reassurance. And we had a really great chat. And her parents also, I could tell they were just like, they could just breathe a little bit, because it's one thing to like read stories on the internet and hear from your doctor that you're going to be okay, but it's another thing to like meet someone who has this and to see that they're more than okay, especially in a disease like NMOSD and MOGAD, where we don't really have the numbers that even MS has. So most patients have actually never ever met another patient in real life before. So anyway, I left, obviously, really my heart was very, very full. And I went home that day thinking, like, as much as they felt my visit was a gift, it was also such a gift to me, because when I started this foundation 11 years ago, at 25 years old, newly diagnosed, never knowing how to do any of what happened or even knowing my own disease, I just always imagined that I would be seeing patients in the hospital all the time. But for one reason or another in logistics, it just never worked out. But what this girl did for me was she humanized why I continue to do the work that I do, even though I'm a patient myself. As the leader of an organization that's growing at the rate that we're growing, sometimes I forget I'm a patient myself, because I'm so focused on, the organizational things that need to be done, the finances, the fundraising, the HR stuff, whatever, the administrative stuff. So she gave me the gift of remembering my why. And, just she did a lot for me too.
Remarkable. Yeah. I think that's really really powerful, Sumaira, and it does speak very much to the compassion and being able to support and be there for others who are struggling within a disease state. Thank you for sharing that.
Of course.
Yeah, and listening to all three of your stories, which are as Kathy mentioned, remarkable. It reinforces this concept that I always look at MS or NMOSD, and I don't like those diseases. I spend every minute of my life to try to fight them. To try to stop MS and eradicate NMOSD from this planet, and everything we can to just eliminate that. But I have a almost like an opposite feeling when I see, and I have the pleasure to witness stories like yours and see how individuals become resilient as a consequence of this diagnosis. And in many cases, their lives change for better, even though they might have disabilities or they might have, the invisible symptoms that Susan was mentioning before. Yes, you have the right arm weakness, but how about everything else that created in my life and all the changes that I had to make in my life? Who's paying attention to that and the toll that creates on you? However, with the right mindset, with the right support system, it is possible to turn that darkness into perhaps a brand new chapter in your life that perhaps is different, is not what you were thinking, prior to this diagnosis. But the question to all three of you, is that possible that the new chapter, this new path, is a positive one?
And I think Dr.
Yeah,
Doggett.
I would love to comment on that. I had a patient who really influenced me. It was really kind of a minor encounter, but many years ago, I had a patient who had type 1 diabetes, the kind that you tend to get as a child, and then you have to take insulin lifelong, and it can be really tough. And I commented on that to the patient. I said, how has it been growing up with type 1 diabetes? That must have been difficult. And she said, actually, it has made me healthier. It's allowed me to tune into myself and really just make sure that I prioritize my health. And that conversation came back to me after my diagnosis, not right away. It took a long time to come back to me, actually, after I got through that shock. But that kind of philosophy has really driven me now in my work with other people with MS as well as NMOSD, but to help them realize they can be healthier than ever if they adopt some of these principles of lifestyle medicine and really take advantage of the good treatments we now have for these conditions. So it doesn't have to be. It can be a turning point. It can be a launch pad for doing other things to realize even bigger goals than you may have had before.
I think it's really an opportunity for intentional living, because all of a sudden when I became a patient, I realized I didn't have finite everything, like infinite everything. Like I had finite energy and I couldn't do everything that I thought I was going to do forever with no limits. And so it became an opportunity to figure out what's important to me. How do I make decisions based on my values? And for example, if there are people that I don't love spending time with, I don't do that anymore. I only do the things that I really want to do. I only volunteer for the things that make me excited, not because I feel like I have to. And it's just been such a beautiful experience. And Lisa, this is the healthiest I've ever been. If I didn't have the MS diagnosis, I don't know if I'd be paying attention to sleep and exercise and how I'm fueling my body. So if I could give the gift of MS back, I would. But here we are, and I think there's a way forward. And sometimes when people are newly diagnosed, it's hard to see that you can find a new normal and incorporate chronic disease into your reality and still be able to be who you were for the most part.
And all I hope is that every newly diagnosed patient can have access to these stories, because listening to all three of you is so inspirational, coming from individuals with medical background, individuals that were successful in their lives and they have a path in their lives, and all of a sudden they had to perhaps pivot, and in a way that not only helped them, but Sumara, I'm going to put you on the spot again. Not only you helped yourself to be better, but you're helping thousands of individuals in this planet. So what are the lessons that you learned that perhaps could apply, or if you have to meet another person that was just diagnosed with NMOSD and you have to give them one sentence or one advice, what would you say?
There's something I find myself telling people all the time now. Um, we really, really, really have to never allow our diseases or our diagnoses define us, consume us, confine us, or limit us from doing the things that we love. You know, my life path was supposed to be 180 degrees different than what it turned out to be. And when all of this happened, I was definitely in crisis because life as I had planned it or I knew it was not even going to be remotely possible. And what I didn't realize, though, of course, in the moment, hindsight is 2020, is that actually my life ended up being so much better and it made so much more sense. You know, like these fabulous ladies, I'd also give back my disease if I could, but at the same time, I think it's made me think you could go one of two ways when something like this happens. You can like crash and crumble and, you know, dwell in despair, which happens. Of course, we're human. I mean, it's depressing to get sick. It's disappointing, all the things. But I think the other route is that you can, you know, fight the good fight, keep an open, optimistic, positive, enthusiastic mind, and push yourself and color outside the lines and think outside of the box and all of those things. And I think getting sick really pushed me and forced me to do things differently. And if I didn't do things differently, maybe I wouldn't be where I am as a patient myself today, being in remission for 6.5 years, but also as the leader of this foundation that's been going on for 11 years. So at the end of the day, none of us have an 8 ball. We have no idea what tomorrow holds for any of us, disease or not. But we have today, and we have, you know, ourselves. And I think if you believe in yourself, you can do whatever you want.
Goodness, again, I'm gonna rewatch these multiple times because there's so much to learn from these. And of course, you know, we send questions to the panelists before, and we haven't asked a single of those questions because every time I listen to something new, I have three more questions that I want to ask. But here I am, another question that I didn't send to you, which is the power of connections and people. And all three of you talked about individuals in your life, whether it's your team or your healthcare team, your family. And often patients ask about that. It's like, you know, should I join a support group? How do I need to create that team around me? Or should I just remove everyone from my life? Don't share that I have MS or NMOSD and just bottle that up in me. So, and I don't think there is a right answer that applies to everyone, but in your personal journey, what are the type of formulas in terms of managing networks, managing people around you that perhaps worked for you? And Susan, I'm going to put you on the spot first.
Sure. Well, I can tell you the first 2 years after my diagnosis, I did not speak the words MS. It frightened me. I even felt shame around it. I don't know why, but I did. And I just could not tell anybody beyond my mom and husband. And I really just dealt with it on my own. But once I felt comfortable enough to share with a few key people that I trusted, like it just felt like there was such a weight that came off my shoulders. And I don't think I could have shared like day one. It just, my brain had to do that, whatever it had to do for me to be ready to speak it. I didn't tell my employer. I just disappeared from the anesthesia world. You know, she's on vacation, she's gone, you know, she's taking time off. What I have to say is once I started speaking to other people who had MS or had connections to MS, my healing journey accelerated because up until then, I was trying to figure everything else on my own in isolation. And it was a slow process. And it wasn't until like I had a community that it helped me like normalize my feelings. I could bounce ideas off of other people. And it was just such a better way to move through this transition to find my new normal.
Right. And before we jump to the next answer, I just want to remind the audience, feel free to write questions, comments in the chat box. We want to hear from you too. You know that we know that you're listening, and perhaps some of these stories resonate with your own stories. So feel free to make your comments available for all of us. And yeah, Lisa or Sumaira, how about you? How did you manage your networks?
Well, I agree with what Dr. Payrovi just said, that I felt tremendous relief in telling people. I actually started telling people pretty quickly, maybe without thinking about it so much. But it was kind of necessary that I share, just given my work situation, and people really, really stepped up for me. I mean, they started covering some of my shifts at the clinic and bringing me meals when I was getting my IV steroids for the first time, and then jumping in with offers of play dates. And I mean, for my kids, it was just incredibly heartwarming and just lifted me up out of my darkest moments. So I have not always been quite as open about MS over the years as I've changed jobs and met new people. But in general, I have found that it is really like helpful for me to be able to share that part of myself. It doesn't define me, but it is a big part of, my life story. And certainly writing my memoir, Up the Down Escalator, was a real big part of just processing and then sharing openly my whole entire story. And it gets into a lot of really kind of vulnerable places for me, but has been incredibly a wonderful experience, getting it out there and having great feedback from people.
Excellent.
Super.
Well, I was looking at some of the comments from the audience, and everyone is asking about lifestyle medicine, and we have so much talent here that we need to go there. So, Lisa, let's start with you. You're a lifestyle medicine physician, and what are your recommendations? How would you approach the conversation with a patient about lifestyle in multiple sclerosis?
Well, I'm fortunate now that I get to do this every day with patients at the UT Health Austin Dell Medical School's MS and Neuroimmunology Center, where we have just formed a lifestyle medicine program just over a year ago, actually. And I got certified in lifestyle medicine because I just realized how important lifestyle was at helping me not just deal with my own MS and my MS symptoms, but prevent other chronic conditions. I'm a family doctor first and foremost, and I know about all of the toll that conditions like heart disease, diabetes, cancer can take on us. And yet so many of those conditions are preventable or potentially treatable through lifestyle. So what are those recommendations? There are 6 tenets of lifestyle medicine per the American College of Lifestyle Medicine, and it's a great organization to check out, ACLM, our American College of Lifestyle Medicine. Those 6 tenets include nutrition, particularly a whole food, plant-based diet, exercise or getting regular physical activity, both strength training and aerobic exercise, sufficient and quality sleep, generally 7 to 9 hours a night, stress resilience, stress management, connection with others, absolutely my favorite one. And then last but not least, avoidance of unhealthy substances.
Excellent. And hopefully this serves as an inspiration, as a starting point. And I will urge anyone in the audience or who listens to this video later to check out Dr. Doggett, Dr. Payrovi's, the Sumaira Foundation, of course, MSAA, because all 4 organizations have wonderful resources to continue this learning process. And Susan, how about you? You are also pretty involved with lifestyle medicine. How do you approach that care in your practice?
Yeah. So everything Dr. Doggett said, and maybe I can kind of talk more about the implementation. A lot of people feel like it's punishment to change their habits. I actually think it's a beautiful journey where you develop a different relationship with yourself and you prioritize different things because it's important to you and you want something different out of your life and you need to create the right environment to make that happen. And I always tell my patients, like, it doesn't matter where you start. You do not have to start with nutrition. You could start anywhere you like. And just you start incorporating one small thing at a time. And what happens over time, especially if you have a community around you, people that are maybe supporting you and rooting you on, or a support group, maybe where they're kind of dealing with similar health conditions. You start bouncing ideas off of each other, and that interaction really kind of starts synergizing and accelerating the process of you building your habit building muscle. So it doesn't matter where you start, and anybody can get started in very simple ways. Like, I have patients who will say, like, I can't stop smoking and I can't give up sugar. Okay, that's fine. If you can't give up the bad, let's put in the good. Like, can I get you to eat a couple more vegetables? Can you spend 5 minutes a day outside just feeling the wind and the sun on your face? There's so many ways to do it, and everybody does it a different way. It's been really the joy of my life to work with patients and watch how they find their way, and they really just step into their life in such a meaningful and powerful way, where they learn to be an active patient, where they walk into their doctor's appointment and they go, what do you think about this, this, and this, And maybe the doctor doesn't know the answer and they have to go find another practitioner, but they're there to advocate for themselves. And I think that's like the patient of the future. Like, we have access to so much information. There's so many wonderful resources that we can use to start improving our health. And the work we do with our neurologists is so important. Those medications can be just so key in helping slow down or halt a disease process. But lifestyle actually helps improve your cellular health, and it helps you to like grow the good soil so that you can flourish. And both approaches are important. I can't say that one's more than important than the other. They actually work best together. They synergize with each other. And I hope that everybody just starts to find one small thing and they just start working on that.
So, and in the brain health clinic, we work with a model called marginal gains. And to your point, and with marginal gains explains that if you have to change something complex like lifestyle that has so many pillars, like Dr. Doggett mentioned, rather than going from 0 to 100 at once in one aspect, you're going to get better results if you look at all of the different pillars and try to improve by baby steps, like maybe 1%. And understand that in that journey, you might go to, 5% better in your diet, and maybe you might go back. One day you're walking by McDonald's and you get a burger. It's like, oh, geez, no, I know that that's not good for me. But that happens, right? And we should allow that to happen so we don't feel that we are not accomplishing what we want. So we need to understand that change is a cycle, and that cycle sometimes we rebound and we go back and we continue to learn and we continue to improve. So maybe we can pause here for a minute, and I want to make sure that Alexis Klein has some time to talk about another wonderful organization that has been helping MS patients for decades. And maybe you got inspired by this conversation, and tell us more about MSAA, Alexis.
Yeah, thank you so much. And you can delete this out. The bulges of the panel here today.
Oh, here you go. You're back.
Oh, no.
Okay.
I'm so sorry. No, I was just saying, can you hear me? I'm so sorry that I just am so appreciative to be here today, and it's so inspiring to be with this panel. And I feel especially lucky to learn and be here and be part of this community as an advocate too. Being a part of MSAA, as well as a family member and care partner to somebody living with MS. And so being able to serve the community through the Multiple Sclerosis Association of America has been so powerful and beautiful. And I have to also mention Dr. Doggett's book has been just such an incredible piece of advocacy storytelling that we've been able to share with the community. And I just can't prop that up enough. But to talk about MSAA just briefly, we are a national nonprofit. We serve across the country. We have a number of really wonderful direct resources and services that can help support people, especially if there's any challenges or experiencing financial hardships. We're one of the only organizations that has an MRI access program. We also have cooling equipment and some other things. And then really important, and I think that Dr. Doggett and Dr. Payrovi and Samira all talked about this too, is health literacy and really figuring out ways that we can share about best practices in MS care, because we do know it's variable. Who you're seeing and what kind of clinician you have might define the kind of care and treatment that you're going to get. And maybe sometimes it doesn't always align with what your vision is for what your long-term outcomes should be like. And so I think that one of the things that MSA does with these health literacy programs is they're available online. We also have some web-based ones that are really neat. Some of our upcoming programmatic topics are really Journey of the Newly Diagnosed. We have a neat podcast coming out, and we can put the chat links in so we can share it, but really just appreciating the opportunity to share and work with everybody and encouraging you, if you need something, if you want resources, looking for connection, please connect with us, reach out to MSAA. Thanks so much for that question.
Alexis, but I want to highlight one of the many things that you mentioned, which is the MRI Access Program. Can you tell us just a little bit more, because it's so fundamental and it's been transformative for so many patients?
Yeah, absolutely. So our MRI Access program has been around basically since MRI was recommended as a diagnostic or disease monitoring tool for MS. And so we are the only national nonprofit that helps to cover the cost of MRI for eligible individuals. And this is just a really special program for us because we understand and recognize that even though there's improved healthcare systems, there's improved insurance systems and coverages, we acknowledge that that does not cover the cost of the care of living with multiple sclerosis and other chronic and complex illnesses. And so we really encourage and ask, if you're going through challenges, if you're needing an MRI, come through and talk to us and see if there's something that we can do to help complement it. And I think, one of the most powerful stories that we have really learned and that we're able to share is examples of people who maybe had to go a significant amount of time without their MRI, basically because they didn't want to pay off the cost of their care over time. And there's more important responsibilities that are in their life. And so I think that's one of the ways that MSAA really wants to be there, as kind of a networking community to either provide those resources or provide the support and services and love to be able to kind of overcome some of those barriers or challenges as they're encouraged in coming.
Amazing, and so linked and close to patients. That's what I love about your organization. It's not just talking about the pie in the sky project. It's truly getting and walking the journey with patients alongside. So thank you for everything you do. And Sumaira, you're here not only representing yourself and your story, but also your foundation. So can you tell us a little bit more about TSF?
Sure. So TSF stands for the Samira Foundation, and we are a global nonprofit organization dedicated to raising awareness of NMOSD, MOGAD, and other rare neuroimmune conditions. We're very passionate about building communities of support for patients and their caregivers. We support research and fellowships and advocate on behalf of patients. And I love to say that we are truly patient-led, patient-powered, science-driven, therapy agnostic, and diversity continues to be a superpower for our organization.
Excellent. And similar to the MRI program, I remember you mentioning something about making the AQP4 antibody testing available in different places in the world. Can you tell us more about that?
Of course, thank you for asking. So, as many people know, diagnosing NMOSD and MOGAD is still very challenging, even in the United States. In the United States, we have issues of people not knowing to order the test. There being different types of tests. There's the ELISA test, the cell-based assay, the fixed cell-based assay, the live cell-based assay, and all that kind of stuff. But also insurance doesn't always cover the test. It takes a long time. There's not many centers that do it. So those are problems unique to the US, but at least we have the tests here. Most of the world actually doesn't have this kind of access to the test kits, but also the efficiency in getting the test back. So what we're very passionate about as an organization, it's called the Global Diagnostics Initiative, and we are making testing kits for NMOSD and MOGAD available specifically in lower middle income countries so that folks can get diagnosed in their own countries correctly and efficiently. And to layer that effort, we've also been supporting diagnostic fellowships for clinicians from lower to middle income countries to learn how to do the live cell-based assay testing at the University of Oxford or the University of Verona. So it's a train the trainer program, and we hope that we can just keep training a lot of different people on how to diagnose patients while also getting these test kits everywhere as soon as possible.
It's impressive. It's impressive. So, Kathy, I'm going to bring it back to you. Maybe we can go, one question or two for panelists just to wrap things up. But I'm just going to say I'm so inspired, so honored to be part of this moment. It's a moment that actually I think we're going to reflect back multiple days from today and think about it. And let me hear that phrase again, because you share so many powerful statements and so inspirational, and I'm sure it's going to be so helpful for so many individuals that perhaps are going through the same journey that you went through or you're going now. I saw a comment in the chat box. If you can also share your website or any way in which patients can access your resources or your books or anything you want to share with the audience, please feel free to do that. And I'm going to end here. Kathy, you take it from there. And the last remark, I wish every Monday starts like this, because I'm so inspired and so ready for the rest of the week. So thank you again for being part of this panel.
Well, the sad thing is that we only have an hour, and there are so many additional questions that I would love to delve into. And even though we had prepared questions, I don't think we can address all of those at this time. But one thing that I do not want to pass up, Dr. Payrovi, you are a co-founder of True Medicine, and I think it would be really interesting for the audience to also hear a little bit about True Medicine and what that offers patients. So if you could speak a little bit about that.
Sure. And True Medicine was just my way to give back to the MS community, where it was so hard for me to find the information of how to get myself healthy. And I was a physician. Like, how would I ever expect a layperson to do that? So it was just my way of putting together a program where people who have an interest in improving their health and want to engage in lifestyle medicine can come in and just get the information that they need. So they're not wasting time and money and resources on things that are floating around on the internet and maybe not helpful. Just really helping people focus on the implementation piece. And even most recently, I'm actually sort of kind of opened up the program to everybody. The work I do in my clinical practice at Stanford, I treat everything. So I am actually changing websites, or both websites will be up, the truemedicinems.com and drsusanpayrovi.com. You can find me in both of those places. My goal is to just get the right information in people's hands, that it's evidence-based, it's safe, it's effective, and it's not going to interfere with your medications and other therapies. That's all really important. So yeah, I'd love to hear from anybody who's interested. I have a lot of wonderful contacts in the MS community. There's so many wonderful people here that are willing to help, and I just feel just so inspired to be part of this panel. Thank you.
All right. Fantastic. Well, there was one particular comment or question that was in the chat box, and I figured even though there's quite a few, I'm going to delve into this one in particular. Somebody wrote in saying, your stories have been inspirational. What do you say to a patient who has autoimmune syndrome and tries to be positive but finds it challenging at times? And I think that might be across the board. So either Dr. Doggett, Sumaira, or Dr. Payrovi, if one of you would like to address that one.
Sure, I can try to jump in. First of all, I feel your pain. It is really, really tough to have an autoimmune condition given the symptoms, the uncertainty, especially that comes along with that. And it can be difficult to be positive. I think it's normal to not always be positive. We all have our days where we're feeling, frustrated and angry, and that's normal. But I think really trying to make sure you're clear on do the work to get clear on your sense of purpose. Really trying to find at least something to be, look forward to or feel grateful for every day. For me, journaling is very beneficial, helping me kind of process things and also, deal with anxiety and stress. And then the final little tidbit is mindfulness meditation has been incredibly powerful for me in dealing with my symptoms, helping me with my mindset, reducing anxiety, improving my overall mood and outlook. So just those are a few tools, but if last, as one last resort, not even last resort, actually, a good option is to also seek counseling from a licensed therapist who can help you just in dealing with such a challenging condition.
Fantastic. Sumara, did you want to chime in and say anything there too? I noticed you were
Sure. Yeah.
about to speak as well.
All of the above for sure. And to Dr. Doggett's point, I think you need to allow yourself to feel those not so pleasant feelings too, because it helps you appreciate when you're feeling great. And one thing Dr. Miravalle actually taught me was to end your day writing down 3 good things that happen, no matter how small they are. And I've started to do this myself, and I highly recommend. There's always something good. There has to be. Not all is always gloom and doom. And I think it's important for us autoimmune disease patients or whatever patient to celebrate your micro victories too. So if you go the day without a headache, that's a win, and I think it's good for you to acknowledge little wins too. No win is too small. So allow yourself to feel what you're feeling. You're human. But yeah, maybe incorporate this exercise that I recently did too.
Fantastic. Well, I have just say I'm so honored that
I
all
gotta
of
chime
you.
in, Kathy, there,
Okay.
but you better believe that this is gonna be in my 3 good things for a month now, because this has been an amazing program. Thank you for sharing every story that you did. Thank you for being who you are, so inspirational, strong leaders, and representing all of us with the work and your life story. So thank you again.
Yeah, well, I will piggyback off of that. Dr. Miravalle and I are always so honored to have really great speakers to these webinars, but this evening has been particularly wonderful. And so I cannot thank you all enough for participating and sharing your stories and enlightening the rest of the MS community and those with NMOSD and MOGAD. So your work is tremendous, and I think it really is powerful for others who are out there. On a quick side note, because I know we just have 2 minutes left before the hour is over, our next conversations on brain health will be on April 14th. So again, that's second Monday of the month. So April 14th will be the next conversations, and we're looking to have Dr. Miravalle provide us with some highlights and updates from the ACTRIMS meeting, which is a large conference on multiple sclerosis. So he will provide us with some updates next month. And then for any of those who are interested in the Brain Health Program, it's an educational program for individuals with multiple sclerosis. I will be running that next program starting in April as well, which will start April 12th and run through May 1st. So anybody who is interested in participating in that upcoming program, feel free to reach out to me, and I will be more than happy to get you enrolled. So on that note, again, huge thank you, ladies, for an incredible evening and for participating with us tonight. Again, it's been such an honor. Hope everybody has a great evening, and we'll see you next month. Thanks so much. Okay.